In the following case study from our practice, we see Skipper, 8 years old. The German Shepherd mongrel is presented with severe lameness of the right rear supporting leg, which has persisted for several days. The dog shows a relieving posture. In movement, the leg is pulled up, in the turn it is briefly placed on the tip of the toe, and then the leg is fully unloaded and tightened again in movement. The supporting leg lameness also shows in stance. Skipper stretches the limb through and places it on the tip of the toe. In the orthopedic examination, the toes, the ankle joint and the Achilles tendon remain inconspicuous. The knee, however, shows significant swelling with joint effusion, meaning increased synovial filling. The patella tendon is reactive and the drawer test is also positive. The tibial compression test remains negative. The bone of the upper and lower leg is slightly painful. The examination of the right hip joint is again without pathological findings. The lumbar spine as well as the back muscles are tender. In addition, the functional mobility in the pelvis is clearly limited. This is due to inflammation and instability in the right knee. The resulting movement pattern can be seen well in the first video sequence here. Subsequent X-ray images show typical changes in the right knee. The clinical findings can be causally attributed to the results of the radiographs as well as the gait pattern. The dog has a partial cruciate ligament tear. However, based on the examinations, there is no evidence of meniscal pathology. As the dog is only in transit, it was decided against surgery with TPLO for the treatment. Instead, PRP therapy was performed.
PRP stands for platelet-rich plasma. The effectiveness results as follows. The main function of platelets is to enable blood clotting. Blood generally consists of 55% plasma and 45% blood cells, of which only about 1% are white blood cells and platelets. The latter, however, contains hundreds of proteins called growth factors, which are crucial for healing injuries. To enrich them, we first separate plasma and platelets from the rest of the blood. The increased concentration at the end of the process is what makes PRP therapy effective. The body's own bioactive proteins contained in PRP can replace, repair and regenerate tissue. We can direct these growth factors directly to the area of pain through the PRP. When tissue is injured, platelets aggregate at the injury site and stimulate the clotting cycle. Activated platelets release a large number of growth factors that will accelerate the healing of Skipper's injured tissue.
We performed the PRP therapy under sterile conditions with sedation. This should allow the tissue to heal faster, more efficiently, and more completely. The progress of the therapy was monitored 6 weeks after infiltration. This video sequence shows the restored, normal gait pattern. This development can also be seen in the results of the functional, kinematic features with Lupo gait. The objective, comparable measurement resulted in the present values. Light blue represents the gait pattern before infiltration, dark blue 6 weeks after. The stance phase in the right knee increased from 0.05 to 0.28 seconds. This corresponds to the normal stance phase of a healthy dog. Furthermore, a positive development of extension and flexion can be seen. This is now practically symmetrical in the hindquarters. The forehand also shows an improvement. This is not surprising, as the left shoulder limb mass had to compensate for the right pelvic limb mass. Also, the PVF is now balanced and corresponds to the normal distribution. In summary, PRP therapy can be a real alternative for a partial cruciate ligament tear without meniscal pathology. It remains to be mentioned, however, that TPLO or TTA continue to be the gold standard in therapy for cruciate ligament tears.